And let me know if my bandwidth becomes an issue, if I start to sound, if my sound goes downhill or anything like that, we can turn off videos. So before we get started, just a little bit of housekeeping. If you are able to be on video and are open to that, we love having the video. I want to keep this pretty informal and conversational, so it's always nice to be able to see folks that are on, but you of course do not have to. Request that you just keep yourself muted when not speaking, but there will be, times to speak up, so can come on and off of mute. We will pause plenty for questions, but feel free to use the chat box anytime, and I'll keep that up so I can monitor it. And my colleague Sydney, who you all haven't met yet, but she'll be joining just a little bit late. But if you have any technical issues throughout, please feel free to email her. Her email address is on the screen, or you can chat her. For Hepzibah folks, her email is sydney.edmond, EDMOND, @iphionline.org. So she can help out with anything technical. I mentioned we'll be recording, so if you want to go back and watch anything or share with colleagues, feel free. And like I said, I want to keep this pretty conversational, so just as a heads up, I may be calling on folks, so fair warning. So today, we'll start with just a quick round of introductions. I want to touch very briefly on some nutrition considerations with some of the populations you all work with, so including folks that are experiencing housing insecurity or substance use disorder. We know that doesn't encompass everyone, but thought it was worth touching on. We'll talk about the dietary guidelines for Americans, some key nutrients, the MyPlate image and tool, and then we will do a quick spotlight on child nutrition for those of you who are serving children. And a few other considerations, and we'll save some time at the end to go over any questions. So first, you may remember this picture from our group meeting, but this is our team that you'll be working with. Jana and Pasong are not joining today, but they will be involved in a lot of this work. And I, of course, will be your primary contact. I also wanted to mention I have too many letters after my name, and 6 of them mean basically the same thing. The RDN and LDN just means I'm a registered and licensed dietitian. So I have several years of nutrition background and experience. So I hope you all feel free to lean on me for any questions that you might have. I'm more than happy to help in any way. So now I want to hear from folks on the phone. If we could go around and you can just share your name, your role or your title and your organization. And also, as I put in the email a few days ago, would love for everyone to share one nutrition related question that they would like the answer to. And we'll see if we can answer it as we go. And I'll put these in the chat too to keep track of them. So is anyone willing to go first?
This is Debbie Pontrelli, the Assistant Director of Group Homes at Hepzibah. My nutrition question is low fat better than fat-free, or is sugar-free better than low-fat, fat-free? I get confused sometimes about which is a better option, so that would be my question.
That's a great question. Thanks so much, Debbie. Is there anyone else there with you that would want to go? Or are you?
Sure.
So my name is Connie Robinson. I'm the new nurse here. I'm here part-time at Hepzibah. And my nutrition question would be around whole grain versus multigrain, because we hear a lot when ordering bread or making sandwiches for the children. Should we be using things that are whole wheat? Should we be using multigrain? Is whole wheat even healthy? So that would be my concern.
Another great question. Thank you. It's nice to meet you, Connie.
Thank you.
Joseph Robinson, Hepzibah Kitchen Manager. My nutrition question is about milk. With the different milks out here, new almond milk, like what 2% milk, what is the best milk for kids growing up and help them as they're aging?
Thank you, Joseph. Love that question. I'm just trying to write everything down and make sure I capture it. Different milks. What is, so specifically, what's the best choice for kids?
Yes.
Great, got it. Thank you. Is there anyone else from the Hepzibah team? Okay, great. Is anyone else ready to go?
We could go.
Great.
I'm Sue Dever, the Emergency Services Coordinator with Beds Plus. And my question is, we ask our meal teams to provide a protein and a starch. What are healthy starches? I mean, when I think starch, I think pasta, potatoes, which are really all unhealthy for you. So what are healthy options or healthy alternatives for these starches?
Awesome. Thanks, Sue. I got it. Janie, would you like to go as part of the Beds team?
Janie, what's your question?
I think that I've been looking at the things in the pantry here, and many of the things that we get donated, if you just serve them once and worried about the sodium and the saturated fat, it wouldn't be that bad. But on some of the products that we get, but I would like to have an alternative that we could afford and donors could afford, that we could hand out, and people, say for instance in the motels, could microwave or keep it in the refrigerator. But that's a big problem here.
Thanks, Janie. Appreciate it. And I was getting a little bit of background noise there. So if folks are just able to stay muted unless you're speaking, I think it might help with that. All right, so I think we have Grace and Nancy still.
I can go next. My name is Grace Cordoni. I work as a residential supervisor at Hepzibah. I work directly with the kids. So I guess one of my nutrition questions would be is that we have a lot of picky eaters on like how to get like all their nutritional needs when they're being when they're have such stipulations on what they will eat, and like the benefit of giving them foods versus getting them nutritious foods.
Thanks, Grace. Appreciate that question. Just trying to take notes in the chat. Food versus nutritional food. Okay. I might ask some of you to remind me of the details when we get there. Perfect. Nancy, are you ready to go? We're not able to hear you if you're speaking. Okay. Nancy, if you're able to hear us, maybe just put it in the chat. Sorry for the trouble. And I think my colleague Sydney's on the line now. Sydney, would you be able to introduce yourself? And if you want to throw a nutrition question into the bucket, you are more than welcome to.
Hi, everyone. Yeah, I don't have a specific nutrition question, but my name is Sydney Edmond. I'm a program manager for the Alliance for Health Equity with IPHI, and I also work on some food access, food and nutrition security projects at IPHI, and work alongside Catherine with some of those. So nice to meet everyone.
Thanks, Sydney. And Sydney's who I offered up as your technical support. So if you have any trouble, you can private chat her or you can email her. Thanks, Sydney. I threw her into that very last minute, so. And Sydney, if you might also be willing to help me monitor the chat, it gets kind of hidden when I hide my screen.
Yeah, I can do
Really
that for you.
appreciate that. Thanks. All right, so let's go ahead and get started. Thank you all for your introductions and for your nutrition questions. They are awesome, and I think we'll be able to answer some of them throughout. So keep track of your question, and if you happen to remember others' questions and I put them in the chat, we'll see how many of them we have answered by the end. So first wanted to just provide a very quick note on nutrition and some of the populations that are of particular importance to your organization. So again, this is not doing the whole topic justice, but thought it was important to introduce the topic. So first, of course, when folks are experiencing housing insecurity, having a nutritious diet can be extremely challenging. Some of the barriers, of course, include just not enough affordable, healthy options available where folks might live, and other barriers to accessing that food. And then when folks do have nutritious foods, storage can be a problem, food safety can be a problem, and preparation can be a challenge if folks don't have consistent access to, you know, a refrigerator or a place to put food or a way to cook food. Those can all be challenging. And then we see, unfortunately, outcomes. We see higher incidence of diet-related chronic diseases among our housing insecure populations. And because chronic diseases are extremely costly to manage and our healthcare system is expensive, that puts additional economic strain on those individuals. So just some things to keep in mind there. Is anyone on the line who, you know, works directly with folks experiencing housing insecurity have anything to add about barriers or outcomes that you see related to nutrition? So the next piece I wanted to touch on is malnutrition and substance use disorders. So malnutrition, which just means not getting enough of the nutrients that we need for good health, is very, very common among individuals with substance use disorder, which I'm sure some of you know much better than I do. And we see this for several reasons, including disrupted eating patterns, and certain nutrients are also not absorbed as well in the body when folks are using substances. Those nutrients include vitamin D, B vitamins, iron, and amino acids. And when folks are experiencing malnutrition, so when they are malnourished, that's been linked in the research to both an increase in drug-seeking behavior and a decrease in the ability to resist substances. We also have seen that treatment is more effective when nutritional support is incorporated. And as an additional note, we know that depression and suicidal thoughts sometimes co-occur with substance use disorder, and those depression and suicidal thoughts are associated with decreased neurotransmitter signaling. And I don't want to get too technical, but good nutrition helps to support those pathways. So the foods we eat are directly related to our neurotransmitters. So having a balanced, complete diet can help with that and can help reduce depression and suicidal thoughts. Of course, it's not the only answer, but it's an important component. And finally, we know that folks recovering from substance use disorder may actually experience increased cravings for sweet foods. And there's some evidence to support confusion or what they call addiction transfer when recovering from substance use disorder between cravings for substances and cravings for food. So there's just limited evidence out there about that component, but wanted to share that information. And I will send a resource that has much more information on nutrition and substance use disorder along with the recording for this call if anyone's interested. So switching gears now to talk about the dietary guidelines for Americans. We are on the 9th edition of these guidelines. It covers 2020, so they just came out, and will carry us through 2025. The dietary guidelines for Americans are the guiding document of what Americans should eat for good health and well-being. It's updated every 5 years. That's why we're going from 2020 to 2025. They do an update. And it's a co-publication between the United States Department of Agriculture and the United States Department of Health and Human Services. And in order to create the dietary guidelines, a advisory committee, a group of scientists and professors and other nutrition and health professionals come together and do a very, very comprehensive review of all the nutrition science that's come out in the last 5 years. And they create a very long report, and that report is used to develop the dietary guidelines. So the dietary guidelines are intended to be used to design federal nutrition policy. They can be taken and adapted for use for groups and individuals, but they're not necessarily used by the general public. We know that nutrition is very personal. People have different needs based on their health conditions, based on their culture, their religious practices, just their preferences. So it's not a catch-all, but it is one document that we can use to inform the advice we give and the programs we develop. So this slide has a lot of information, and it's kind of small, and I can send out this document with the recording, but this is a summary document from the dietary guidelines. So I'll just touch on a couple of the sections. Up here in this upper left corner, you can see the 4 main guidelines that came out of this document. So one is to follow a healthy dietary pattern at every life stage. So from birth all the way through older adulthood, trying to follow that dietary pattern. The second is to customize and enjoy nutrient-dense food and beverage choices to reflect your personal preferences, cultural traditions, and budgetary considerations. So again, it's reflecting that we know one thing is not going to work for everyone in exactly the same way. The third recommendation or guideline is to focus on meeting food group needs with nutrient-dense foods and beverages, and to stay within calorie limits. So trying to look at foods that are really dense in those nutrients we like, and staying, within the energy needs that you have. Then the last guideline is to limit foods and beverages that are higher in added sugars, saturated fat, and sodium, and also to limit alcoholic beverages. So over here, this second section is talking about how we're doing as Americans at meeting these guidelines. So all the scores you see above folks' head, that's the scores that different age groups are getting out of 100 at healthy eating. So you can see we vary from 51 to 63. So I guess if we were in school, that would be a D- or an F, unfortunately. But you can see we're doing the best at the very youngest age groups. So those from 2 to 4 are getting a 61. And also those over age 60 are getting a 63. But it kind of goes down throughout childhood and into teenage years, and then starts to creep back up again as we age. This section down in the bottom left, number 3, is looking at how we're doing at meeting different nutrient suggestions. So down here in the very bottom left, it's saying that 75% of people are not getting enough fruits, vegetables, and dairy. The next one is saying that 63% are exceeding the limit for added sugars, 77% exceed the limit for saturated fat, and 90% exceed the chronic disease risk reduction limits for sodium. So where most of us are not getting enough fruits, vegetables, and dairy, and are getting a little too much added sugar, saturated fat, and sodium. The last one I want to point out is this in the bottom right, this circle that you see. This is just showing approximately how many calories we get in a day. That's the big blue circle. And then the white circle in the middle is the proportion of those calories that we need to meet all of our nutrient requirements. So it's saying that you can get everything you need in a day and use up 85% of your calories. So that means you have 15% of calories left over to use on other things. So that's where those added sugars and saturated fats come in. So we want to, if we're not going above our calorie limits, about 85% of what we eat should be going towards meeting our needs. Any clarifying questions thus far? I know this has been a lot. Okay. So how do we actually use the dietary guidelines? So the dietary guidelines I mentioned are just a reference document. So one thing that's been created is this document that you see on the very left. It's called the Food Service Guidelines for Federal Facilities. And that document is the operationalization of the dietary guidelines for food service. So this document's basically saying, it's taking the dietary guidelines and saying, as food service operators, what do we need to be serving so that folks can meet the dietary guidelines? What do we need to be providing so that it's in line with those practices? I used the Food Service Guidelines for Federal Facilities to create your assessments. So for those of you who have seen those checklists that I sent, I used that document to create those checklists so that we could kind of see, you know, where are we at in meeting the dietary guidelines as institutions. Another way that you might have seen it being used is if any of your organizations participate in federal feeding programs. So that could be CACFP for kids or older adults, the National School Lunch Program or the Summer Food Service Program. If you're familiar with any of those programs are informed by the dietary guidelines. And then this image that you see on the very right is called MyPlate. It's the consumer-facing message of the dietary guidelines, which we will talk more about soon. So switching gears to nutrients. So looking at getting really minuscule and talking about nutrients. We'll look at what they are, which ones we're most concerned about, and one of the ones we like to promote. So a nutrient's just defined as a substance or ingredient that promotes growth, provides energy, and maintains life. And that's according to the dictionary. There are 6 categories of nutrients. Those are carbohydrates, fats, protein, vitamins, minerals, and water. We need all 6 of those categories for survival and for good health. And as you can hopefully see from the pictures, there are foods that we might traditionally think of as healthy or as less healthy in each of the categories. So both apples and white bread are rich in carbohydrates. They both have a lot of carbohydrates. Salmon has a lot of fat, as does butter. Lentils are an excellent source of protein, and hot dogs also have a lot of protein. Oranges have lots of vitamins, and vitamins are also added in large quantities into most sugary cereals. Minerals, a banana has lots of potassium and other minerals, and pretzels also have lots of sodium, which is a mineral. And then water, of course, water has a lot of water, and then sugary beverages like soda is also mostly water. So no nutrient category is good or bad. They're just a way that we're defining nutrients. That being said, there are 3 primary nutrients that we're concerned about within these 6 categories. So it's not any of the categories themselves that we're worried about, but there are 3 primary nutrients of concern, and we have touched on them. Can anyone tell me what one of them is? And you can put it in the chat.
Salt.
Yep, thanks, Sue. That's one of them. What's another?
Fat.
Yep, specifically saturated fat.
Sugar.
Yep, added sugars. Nailed it. Thank you. Okay. So we are concerned about saturated fat, which falls within the fat category, sodium or salt, and added sugars. So saturated fats, what are they? Important first question. Saturated fats at a molecular level just means that there are no double bonds in between the carbon atoms. And I will not quiz you on this, but just think it's interesting to help understand. The fact that there are no double bonds makes the molecule very straight. And the fact that they're very straight makes them solid at room temperature. So we could maybe think about dry spaghetti versus cooked spaghetti. The dry spaghetti is very straight. It sits nicely together. Whereas if you cook spaghetti, it gets a little more unruly. It's kind of all over the place and flows a bit more. So since saturated fats are more compact, they are solid at room temperature. They don't flow. But unsaturated fats have these double bonds and they flow. So that's the difference. But what is the concern with saturated fat specifically? We know that excess saturated fat consumption is associated with heart disease. And you can see from the diagram on the right that heart disease is the leading cause of death in the United States. So that is the primary reason why folks are dying in this country. And we have seen from the research that if we replace saturated fat with unsaturated fat, we are decreasing the incidence of heart disease among adults, so fewer people are getting heart disease, and there's less cholesterol in adults and some children, especially boys. And we're worried about cholesterol because it's a marker of heart disease risk. So we're seeing if we can decrease saturated fat, folks are better off when it comes to heart disease. So where do we see saturated fats? They are primarily found in animal sources. So in beef, lamb, or pork are all pretty high in saturated fat. So is poultry, but specifically when the skin is on it, that's where most of the saturated fat lives. Lard, cream, and butter all have quite a bit of saturated fat, as do regular milk and regular cheese. So I'm remembering one of your questions now was about low fat or not. And I'm thinking we may be hitting on it here. It also is high in baked treats. So, you know, in your pastries or sweets. So like dessert or breakfast breads or donuts or that type of thing. Also in fried foods, so anything you're putting in a fryer. The chart on the right are different types of oils and how much saturated and unsaturated fats they have. So any of these oils that you're seeing that have the really long green bar, those are the highest in saturated fat. So we're seeing from this chart that like coconut oil and palm kernel oil and butter and cocoa butter and beef tallow are all quite high in saturated fat. And then the options where we're seeing lots of orange or yellow, like flaxseed oil or sunflower seed oil or soybean oil or sesame oil are all higher in unsaturated fat. So all these different oils have a mix, but it just depends on which ones have more or less. So now I would like to hear from you all. Where do you see saturated fats in your operations? So in your housing facilities, does it show up primarily in meat, in dairy, in baked goods, in fried foods? Where do you think it's showing up? if anyone's willing to unmute, or you can put it in the chat.
The left.
Sorry, the what? The left? This one?
Uh-huh.
Yeah.
Definitely.
Thanks, Janie. Anyone else willing to share? You can put it in the chat too if you're on the platform.
Where do we see it in our foods here?
Fried. And fried food?
Fried foods? Is that Joseph?
Yes.
Thanks, Joseph.
I think ours is mainly the baked goods,
Baked goods.
or not even baked. Yeah, the cookies and
Dessert.
cookies and brownies, that kind of thing that get included with each of the meals.
Yeah. Thanks, Sue. That's helpful. So I'm hearing kind of all of them. You know, I heard the meats. I heard the baked goods. I heard the desserts. Yeah, those are all places it shows up. Thank you all. So moving on to our next nutrient of concern is sodium. So first, what is sodium? We often exchange it with salt, and for everyday practice, that's totally fine. They're not quite the same thing. Salt is made up of sodium and chloride. So table salt is 40% sodium and 60% chloride. Sodium is the part of salt that we're concerned about. So that's why we always talk about sodium instead of salt. We're not so worried about the chloride. The reason we worry about salt is that it's directly related to blood pressure. So high blood pressure, which is also known as hypertension, contributes to the risk of cardiovascular disease. And you may remember that cardiovascular disease is the primary cause of death in the United States. And unfortunately, nearly half of adults in the US, 45%, do have high blood pressure. So that's what you're seeing from that chart on the right. The blue section are folks that do have high blood pressure. So where are we seeing sodium? Not necessarily in any order, but on the left of the screen are the top sources of sodium in the US diet. So it's like your breads and your rolls, pizza, sandwiches, cold cuts like deli meat, has quite a bit of sodium. Soups, your canned soups or your box soups, burritos and tacos, those like savory, salty snacks, and so forth. The chart on the right is from the dietary guidelines, and it's really just showing exactly what proportion of our salt is coming from different sources. So you can see that sandwiches bubble is the biggest, but the rice, pasta, and grains is pretty big. Vegetables, probably mostly canned vegetables, poultry, deli meats, that type of thing are all pretty high sources of sodium. So this is a graph that just is showing how much sodium some of the foods can contribute all on their own. So the red that you're seeing on the graph is where we're starting to get above what we need in a day. The recommended limit for sodium is 2,300 milligrams, but adults actually only really need about 1,300 per day. So you can see that these food items alone are getting us pretty close to our daily intake, and that's before we eat or we drink anything else. So you see this, the ramen's already in kind of that red zone, the seasoned rice is getting pretty close, and the deli meat, just 2 slices, is 500. So again, would love to hear from some of you. Where do you think sodium's mostly showing up in your operations? Is it those salty snacks? Is it sandwiches? Is it, is it meats? What do you think?
I think ours is the sandwiches and the chips. We get a lot of donations of sack lunches,
Yeah.
and they contain the sandwich, chips, and, you know, maybe a piece of fruit, but the sandwich and chips definitely have the large sodium.
Thanks, Sue. That's helpful. Anybody else want to share? Okay, and feel free to put stuff in the chat as you think of it throughout too. So moving on to added sugars. It's our last nutrient of concern. So added sugars just mean sugars that are added into foods and beverages. Sugars occur naturally in our food. They grow that way or they occur that way. But when we add in sugars into the food, then that's what we're more concerned about. So that can be table sugar, that can be honey or agave, it can be syrups. If you look at an ingredients list and it says sucrose or dextrose, that's added sugar. And I have a hint on here. If you're looking at an ingredients list, look for words that end in ose. That's a pretty good sign that you're dealing with added sugar. And it can also be from concentrated fruit or vegetable juices that are added in. So what's the concern? We know that added sugars can put you at higher risk for cardiovascular disease. So again, we're seeing that heart disease risk, cognitive challenges, colon cancer, diabetes, high blood pressure, kidney disease, liver disease, obesity, pancreatic cancer, retina, muscle, and nerve damage. And we also know that too many added sugars can contribute to cavities and tooth decay, inflammation, and challenges related to weight maintenance. So the recommended limit for added sugars, according to the dietary guidelines, are no more than 10% of calories. You may remember that we get 15% of our calories on average for added sugars or saturated fat, so 10% is probably even pretty high. And in fact, the scientific committee that informs the dietary guidelines recommended we drop that down to 6%, but that recommendation wasn't taken up, so it's still at 10%. But more in line with the 6% recommendation, the American Heart Association suggests that men get no more than 9 teaspoons of added sugar a day, and women and children get no more than 6. But in the US, our actual intake is about 13% of our calories going to added sugars, which is 17 teaspoons. So if you're able to put in the chat, I know folks on the phone, I'm sorry you won't be able to see this, but you could say it out loud. Which image or images on the slide do you think have added sugars in them?
Definitely the spaghetti sauce in the jar.
Okay, spaghetti sauce, thank you. And Nancy, I'm seeing your source of sodium in the chat. Thanks for adding that. Any guesses on which of these has added sugars?
The yogurt.
Yogurt. Okay, I'm hearing yogurt, the tomato sauce, anything else?
The white bread.
The bread.
In the granola.
Granola. Okay.
This is a trick. It's everything, isn't it?
Sue's too smart for me. So on the next slide, it's all of them. It is a trick question. I'm sorry. I won't do any more of those, I promise. So the ingredients in foods can be deceiving, and that is unfortunately sometimes done on purpose by the manufacturer. Foods are made to look healthier than they really are. So it's important to read that ingredients list. It shows up, added sugar shows up in some of the craziest places, like peanut butter, I guess we know that, but yeah, like tomato sauce that the Hepzibah team noted, and dressing and bread and, you know, all that stuff. So here's another chart. You can see the recommended daily limit for added sugars for women in the green line, and men is the blue line. So we're seeing that each of these food items or beverage items exceed the daily limit for women all by themselves. and both beverages exceed the daily limit for both women and men, and that muffin comes pretty close. So these items are meeting or they're going beyond the daily limit without any other added sugars being consumed throughout the day. So this is where we're seeing added sugars in the American diet. Sugar sweetened beverages are the primary source. Desserts and sweet snacks are a close second. And then, you know, that sugar we're adding to coffee and tea and coffee drinks. Over on the right just breaks down these two biggest categories. So within sugar sweetened beverages, the main source is soft drinks or soda. And then the second source is fruit drinks. And within desserts and sweet snacks, we're seeing cookies and brownies, ice cream, cakes and pies, all being pretty major sources of added sugar. So from you all, where do you think you're seeing added sugars in your operations? You know, is it beverages? Is it desserts? Is it some of those other less common things like tomato sauces and peanut butter and that sort of thing? What do you think? You can do chat or say it out loud.
We use at Hepzibah, we use a lot of yogurt as a snack, and some of the yogurts are very high in added sugar.
Yeah, thanks, Grace.
And we use granola bars too, which I think often do as well.
Yeah, yeah. Thank you. Anyone else?
Yeah, we get a lot of the meals that come in are pasta dishes.
Mm-hmm.
So, I mean, yeah, we definitely have it with the pasta sauce. And again, each meal comes with some kind of dessert.
Yeah.
So those two have the sugar. And, you know, if they do provide a beverage, it's usually a juice pouch.
Mm-hmm.
You know, usually we don't get the beverages, but when they are provided, it's the juice pouches.
Yeah. Yeah. Thanks, Sue. Appreciate that. So now we're going to talk about something a little more positive. We'll look at fiber. So fiber is defined as the edible, non-digestible component of carbohydrates and lignin that is intrinsic and intact only in plants. So it's coming in plants. It's something that we're able to eat and we're encouraged to eat, but we can't actually digest it. So it goes right through. And there are two types of fiber. One is soluble, which means it dissolves in water. And that's the type of fiber that's helping to lower blood sugar levels and also manage cholesterol levels. There's also insoluble fiber, which means it doesn't dissolve in water, and that helps digestion, regularity, and to prevent constipation. So we care about fiber because it appears to reduce risk of developing heart disease, again, that #1 cause of death, as well as diabetes, diverticular disease, which is a condition of the digestive system, as well as constipation. And unfortunately, more than 90% of women and 97% of men don't meet recommended intake. So the vast majority of us, you know, are not getting enough fiber. So the best sources of fiber come from whole grains. I'm remembering this question about whole grains. Whole grains are an awesome source of fiber. They also are in fresh fruits and vegetables, in legumes, so like your beans and your peas, as well as nuts. So these are all some pictures of sources that are high in fiber. All right, so now we're going to talk about MyPlate. MyPlate is the consumer-facing version of the dietary guidelines. So the idea of MyPlate is it helps us as individuals figure out how to meet the dietary guidelines. And the way that we use it is, this is the recommendation for how to kind of create a dietary pattern over time. It is shaped like a plate because, you know, most of us eat off of a plate at least sometimes, so we have kind of an idea of how that works. But it doesn't have to be a plate. It can be a bowl, it can be a cup, it can be, you know, your hands, whatever you use. It's just a model. But the idea is this is how our diet should look over time. So again, not necessarily every single meal, not necessarily even every day or every week, but an average over time. So what MyPlate is telling us is that half of what we eat should be fruits and vegetables. Just over a quarter of what we eat should be grains. Just under a quarter of what we eat should be protein. And we need to include dairy as well. And the idea is that it's customizable to meet those different dietary and cultural needs and preferences. So, you know, any type of fruit can go in this fruit group. You can cook it different ways. You can not cook it. It's just saying that we need to include that fruit. So starting with fruits and vegetables, again, MyPlate's telling us that half of what we eat should be fruits and vegetables. And the reason for that is fruits and vegetables are super good sources of fiber, also potassium, vitamin A, C, and folate. They are naturally low in fat, low in sodium, and low in calories. And eating lots of fruits and vegetables is shown to reduce risk for heart disease as well as certain cancers. So as housing organizations and folks providing food, these are ways to help meet the guidelines in your food service when it comes to fruits and vegetables. So I pulled these examples from your assessments. And the reason we care about variety, you know, we're seeing offer a variety of fruit, offer a variety of non-fried vegetables, is because variety is important to get all the nutrients we need. We're not finding all of the vitamins in an orange, but some of those, you know, some of the vitamins that aren't in an orange are in an apple and so forth. So by eating a variety, we're ensuring we get everything we need. So providing different sorts of fruit options every day, different sorts of vegetable options every day. It doesn't matter if it's fresh, frozen, canned, dried, just getting it in there somehow. And it can be cooked or not cooked. And trying to make sure that there's a fruit or vegetable every time food is served, even if it's just like a snack or something like that. And if you're getting donations, looking for those donations of fruits or vegetables without added sugars or salts. So I'd love to hear from a couple of you, just your thoughts on fruits and vegetables. It could be ones that you like, how you provide them already, or maybe an opportunity that you see of how you could increase the number of fruits and vegetables that you provide to your communities. Any thoughts?
One of the things we used to do at Hepzibah was we had a setup where every dinner a salad bar was offered with different fixings, and the kids could pick and choose what fixings they wanted, which was a healthy alternative. It didn't have, you know, croutons, and I mean, it did have some shredded cheese in it, but I think if we could customize it in a healthy way, that would be a great option for the kids to have some buy-in.
That's awesome. Thanks so much for sharing that. Did you find that the kids were interested in the salad bar?
Yes, yes.
Yeah, we find sometimes
then,
when they're able to participate in the food, you know, with any kind of the prep or taking it for themselves, that can be really helpful.
Right.
Anyone else?
We always add, like with the lunches that are going out to our clients, we always add an extra piece of fruit.
Nice.
So like today, the meal that came in was a piece of like a riblet, mixed vegetables in a roll, and a cookie. So we added an extra apple or orange to each of those lunches.
Yeah.
So on top of the, you know, and if we don't have anything fresh, which most times we do, we'll throw in either an applesauce or a fruit cup.
There you go. Cool. Thanks, Sue. All right, so whole grains, or grains in general. So the MyPlate is telling us that a little over a quarter of what we eat over the course of our lives should be grains. And the preference is for those to be whole grains, and I will touch on why for that question. So Grains they can be single grains, so it can be like a grain of rice is a grain, oatmeal is a grain, quinoa is a grain, but it can also be products that where grains are the primary ingredient. So bread has more than just grains, but it's mostly grains, so that's how we classify it. And that's the same with cereal and pasta, so those all go in that group. These benefits are very specific to whole grains. Whole grains are rich in fiber, B vitamins, and minerals. Eating whole grains is shown to reduce risk for heart disease and to support digestion as well as weight management. So that's why we like whole grains. This slide is showing us how to tell if a food is a whole grain. The package that you're looking at might say on it 100% whole grain or 100% whole wheat. It might say one of those things. That means it's a whole grain. If it doesn't say that, you can read the ingredients list. And if the very first ingredient says whole before it, it's a whole grain. So I'm remembering with the whole versus multigrain question, multigrain means that there are more than one type of grain in there, but it does not guarantee that any of those grains are whole. So you can have lots of different types of grains, but maybe only some of them are whole or none of them are whole. So if you're looking at two packages, one's multigrain, one's whole grain, the recommendation is to go with the whole grain. So on the other hand, refined grains aren't whole grains. So what happens with refined grains is they are taking the grain and they're stripping away the healthy parts. So there's 3 parts of a grain, the bran, the germ, and the endosperm, and they're taking 2 of those away and just leaving 1. They do put back in some vitamins and minerals, but they don't put back in the fiber. So that's why we don't like, refined grains as much. And just a note to not be fooled by a brown color. It usually happens on bread, but some manufacturers actually dye their products brown to make it look like a whole grain, even though it's not. So this is going back to, sometimes folks try to deceive us with their foods. So it's really important to either look for it to say whole grain or to look at that first ingredient. And this picture that you're seeing is showing that the first ingredient says unbleached enriched flour. And even though the next bit over here says wheat flour, it doesn't say whole wheat flour. So this would be a refined grain. So pop quiz for folks that are, on the phone. Since you have the slides, you can just, say out loud what you think. But which of these 6 options, it's 1 or more, do you think are the whole grains? You can put it in the chat, the numbers next to them. Is it 1, 2, 3, 4, 5, and or 6 are the whole grains? And I'll pull up the chat. Okay, I see a 1 as a whole grain. Any other thoughts? Six. Okay. Thanks, Sue. Grace says 3. So we've got 1, 3, and 6. Okay, Sue says 1 and 6. Folks on the phone, do you have thoughts?
3 or 6.
3 or 6, all right.
I say 1.
1, okay. All right, thank you for obliging. You all got it. It is 1, 3, and 6, so it's all 3 of those. 1 is oatmeal or oats, which are a whole grain in themselves. 3, we know it's a whole grain because right here on the package it says 100% whole wheat. So that means that it's a whole grain. It's telling us right here. And then 6, I know I told you not to be fooled by the color, but it just doesn't usually happen with pasta and rice. So we're assuming this is whole wheat pasta, brown rice, and whole wheat bread. And then I thought maybe some of you would guess 5 because it says organic wheat flour, but you did not. So you got it just right. So ways that you can provide whole grains in your operations. The recommendation is to make at least half of your grains whole grains. There's no problem with going beyond that, but we want to have at least half of those grains being whole. So a way to, serve that is to make sure at least half of what you're putting out are whole grains, or, saying that they're whole or have whole grain as the first ingredient. Another way is to try and, if you're getting donations, is to specifically ask donors for donations of whole grains. So that could be asking for brown rice or wild rice, for whole wheat bread, or for whole corn tortillas. So passing it over to you, what are ways that you already provide whole grains, or do you have any ideas about how you might increase the number of whole grains you provide? Chatter out loud.
I know for breakfast, a lot of the kids like having oatmeal, so sometimes we'll do oatmeal, but the tricky part is they like it with all the flavoring, and
Yeah.
they like the unhealthy part of it, but like we do have oatmeal.
Nice, that's great. Thanks, Grace.
I think we could definitely switch over to rice. We can change our rice and pasta option as well.
Great. Thanks, Joseph.
So this is where I have the problem, because when you cook for a group, it's, whole grains are pricier. And if we're asking, the food teams to make a meal for 30 people, they tend to lean towards the less expensive. So the white breads and the white pastas, and even the oatmeal that, because our clients are in hotels, so they don't have, we send out the packages of oatmeal, which mainly have the sugar and which kind of takes away from the whole oatmeal experience.
Thanks, Sue. So I will just share from my experience. I know the whole grain bread, I buy it at my store, is the same price as the white bread, but I don't know, I think it'd be more if folks from Hepzibah or from others have any experience to share about, inexpensive bulk cooking with whole grains. And I think,
what was the question? I'm sorry.
Sue was just sharing, that the whole grains can be more expensive. So if you had any thoughts about, less expensive options to share.
No, unfortunately, we don't.
No worries. And Sue, I wonder too if, sometimes when you buy in bulk, I'm just thinking about the oatmeal, it can be cheaper if there might be an opportunity to buy the bulk grains and put it into plastic bags, and then it may be even less expensive than those packets and not come with a bunch of added sugars. Just a thought, but we can work on providing some other suggestions about less expensive whole grains. But I know you can get whole grain bread I get mine for $1 a loaf in my store. Okay, thank you all. Go ahead.
I had to take a bathroom break, so I didn't hear for about 3 minutes. But
no worries.
one of the things that I was thinking about is, and of course Sue would know more about it than I, but like if we could get different companies, bread companies, to donate, the whole grains. And then we could tell the people that volunteer to do things to use their bread, because they come up here and get plates and to deliver things in. And if they were going to do sandwiches or something, we could get the bread for them. I don't even know if that was just, you said, you used the word brainstorm, and I was thinking about us.
Yeah. Thank
do you
you for
think?
sharing that, Janie.
Yeah, we get it to offer to the food teams.
Yeah. Okay.
Yeah, I love that idea. Thank you. All right, so our next section is protein. And MyPlate tells us that just under a quarter of what we eat should be protein, which is much less than most folks think about when they think about protein. They think about most of their plate is protein, like a burger or some chicken or something like that, and then the rest of it's sides. But really, we need less than a quarter of what we're eating to be protein. So proteins include, beans, peas, lentils, soy. Those are all really high in protein. Eggs, of course, meat and seafood are great sources of protein, and then nuts and seeds as well. So the main recommendation is to go for lean proteins here. And again, that's to try and avoid too much saturated fat. So protein is rich in B vitamins and vitamin E, iron, zinc, and magnesium. Seafood specifically may reduce risk for heart disease. And proteins themselves, or the parts that make up proteins, are building blocks for many of our body components. So it's absolutely essential. But a lot of proteins, as we've already seen, can be pretty high in saturated fat and sodium. So we just have to be a little careful. So what to look for? The recommendation, other than having it be lean protein, is to vary your protein routine. So to have different sorts of proteins. So ways to do that are to offer a variety of non-fried protein foods. So again, seafood, lean meats, eggs, legumes, etc. To try and offer protein foods from plants. So think about beans, very inexpensive way to provide protein, and they're full of fiber as well. Nuts, seeds, soy products, and doing that at least 3 times a week, but more is great. Offering seafood at least twice a week if possible. I know that can get pricey, but some canned seafoods aren't very expensive. Seeking out donations of poultry, fish, and vegetarian proteins, and then declining donations of processed meats. So thinking about those deli meats, bacon, sausages, those are really high in saturated fat and in sodium. And thinking about avoiding fried proteins as well. So we're back at our brainstorm. Is there ways that you already provide lean proteins, or ideas you have about how to increase the amount of lean protein you provide?
I think we could offer probably more beans as an option here. Some of our kids love shrimp, but we have allergies that we have to be mindful of. So, but yeah, I definitely think it's a work in progress.
Yeah, thanks for sharing that. Any other thoughts?
Some of our food teams, they'll ask, for ideas, suggestions for breakfast rather than us just sending out oatmeal and cereal. And we'll, tell them the hard-boiled eggs are great because they're easy to transport, easy to eat. And sometimes we do get the cheese sticks yet, and when we do get those, we'll include those with their meals.
That's a great idea. Thanks for sharing that too. All right, so our last section. Oh, sorry.
I wanted to tell you something.
Yeah.
On my April newsletter, one of the things that I sent out that I got every bit of it from Sue in the pantry was if they would make a chicken taco soup. And we would give them the ingredients and they would make it. I think one of them made it, but Sue had a can of black beans, stewed tomatoes, corn. She gave me the cooked chicken, but I don't remember from where.
Food pantry.
Anyway, if we provide more things to people and encourage them to let us bring the ingredients, maybe they will cook it. I don't know. Sometimes they don't have pots and pans.
Yeah.
Or, they've thrown them out. I don't know.
Well, I love
But-
Sue's hard-boiled eggs idea too, with them being already kind of ready to go. Thanks for sharing that, Janie. I appreciate it. So our last section is dairy, and that's kind of off to the side here, but having a few servings of dairy a day. So that includes milk, yogurt, cheese, also lactose-free milk, and those milk alternatives. So I'm remembering a question about milk alternatives. So the reason we need dairy is it's rich in calcium, potassium, vitamin D is often added in, and other minerals as well. The low and non-fat options are low in saturated fat. So that's why those are promoted, because they're removing some of that saturated fat that comes from animal products. And dairy is important for bones and teeth and reducing risk of osteoporosis. So recommendations are offer a variety of those low fat or non-fat dairy products or dairy alternatives. So to answer the dairy alternatives question, there's a lot out there. I would just say to look for ones that are fortified. So soy milk's almost always fortified, which means it has calcium and vitamin D in it. Almond milk is a little more hit or miss, and a lot of the new milks, like macadamia nut milk and rice milk, may not be. So I would look at that label and check if it's fortified, but soy milk tends to be a pretty good bet in that space. And then another recommendation is, other than water, just serve healthy beverages and unsweetened low-fat or non-fat milk, or unsweetened milk alternatives. So again, soy milk, etc., are great options. And to also seek out donations of unsweetened beverages. So again, like water, tea, coffee, but also your low-fat or fat-free and sugar-free milk or milk alternatives. So thoughts on dairy? Are there ways that you already provide it, or ideas you have to serve more?
Yes, this is Connie, the nurse at Housekeeping. I have a question. Your dairy recommendations are low fat, no fat. Are those non-fat? Is that for children as well?
Thank you for clarifying that. That's not for children. So children under 1 should not be having any milk at all up until the age of 2. So from 1 to 2, children can have whole milk, not low-fat milk. And after the age of 2, they can have low-fat milk. So those very young kids, and I can share those specific recommendations with you all because I know it's pretty specific. Those very young kids need that extra fat for their growth and development. But then as they start to get older, then we get more concerned about preventing overweight and obesity. Does that answer your question?
Yes, thank you.
Okay. Thanks for clarifying that. Any other questions or thoughts on, ways that you might be able to provide more low-fat dairy for older children and for adults? All right. So now speaking of children, a quick spotlight on childhood nutrition and some extra considerations in that space. So I'm sure you all know this, but child nutrition is really, really important, not only for all the same reasons as we are thinking about adults, for their health and for their well-being, but for children, we also have to think about their growth, their development, their developing taste preferences as they grow up. So what we're giving them now, will be carried or may be carried into adulthood, as well as dietary habits. And unfortunately, if you all remember that diagram that we showed at the beginning, the dietary quality decreases with age as kids grow. So there's a few extra best practices to think about for children. I remember a question about picky foods. It's really important to don't give up on trying new foods. I know it can be really frustrating, but children actually, research has shown that they may have to be introduced to or try new foods 10 to 12 times before they're accepted. So I know most of us, try a few times and get discouraged because the kids don't want them, but they actually need to try them so many times. And that's especially true for foods that are more bitter. It's really important for staff to praise children for trying new or their less preferred foods along those same lines. And it can be helpful for staff to enthusiastically eat and drink the same foods and beverages as children. So they're showing them that it's a positive thing and that we're doing it too. And if staff are eating in front of children, again, either eating the same foods or making sure that what they're eating or drinking is healthy, because they are role models to those kids. Another couple best practices: when kids eat less than half of a meal, asking them if they're full before removing their plate. And similarly, if they ask for seconds, asking children if they're still hungry. So both of these are getting at trying to help the kids tune into their hunger cues so that they're eating when they're hungry and stopping them when they're full, rather than, just eating what's provided, which is what a lot of us do as adults. Not using food to calm upset children or to encourage appropriate behavior. Doing that can lead to kids associating food with reward or punishment, and as opposed to being something that's, used when you're hungry. And it can be great to get older kids involved in serving the food, as well as setting and cleaning tables. So there's a lot to know about child nutrition, and I did just want to briefly share, we have access to an awesome resource called Go Knapsack. It's designed for the child care space, but is full of nutrition best practices and tools. It has its own assessments, and it has tons and tons of resources in it. And our organization actually owns the state's license for this program, so we can absolutely give you access, and I'd be happy to walk anyone through it who's interested. Just let me know. So a few additional considerations before we switch to questions. I want to talk briefly about behavioral design, thinking about transitioning to independent living, and also something called good food purchasing. So behavioral design is all about making the healthy choice the easy choice. So how can we set up our environment so that it's easy to make healthy choices? So the first bullet is about strategically designing the layout of food service venues so it's easy to make those healthy choices. So I'm going back to that, that salad bar that Hepzibah was talking about. If that's, before the other food, then folks may be more likely to start with salad, and that fills up their plate, or putting fruits and vegetables, at decision-making points, or putting the healthier vending options at eye level instead of all the way down at the bottom. Another thing to think about is making healthier options the default choice. So that just means if folks don't specify otherwise, that's what they get. So if you have, say, one pasta that's whole grain pasta and one pasta that's white pasta, you give everyone the whole grain pasta unless they say, I want the other pasta. So it's basically having them opt out of the healthy option instead of opt in. You can think about using price incentives. I know most of you aren't selling food, but if you're thinking about like vending machines or that type of thing, where the vending machine on the screen, you can see all the waters are $1 and the sugary beverages are $1.25. You can also think about promoting healthy portion sizes by providing smaller plates and bowls and glasses and other dishware, because I know often we've got, you know, these big, huge plates or platters and giant cups and that type of thing. So thinking about how much of foods we're providing. And then you can use information or displays or signage to promote healthier options. So thinking about transitioning to independent living, one reason we really like nutrition guidelines and are working in this space is providing a healthier food environment for folks is a model of a healthy dietary pattern that can be taken on to other living situations. So it's providing that example. But beyond that, it can also be great to think about nutrition education, cooking education or classes, healthy shopping on a budget. And we are fortunate in Chicago and Cook County to have lots of partners that specialize in this type of work. So I know Beds, I'm going to connect you to our SNAP Ed partners, but if other folks are interested, feel free to reach out and we can brainstorm, you know, what other kinds of resources you might be able to bring in. And if anyone has any other ideas about other considerations as folks transition, please feel free to put those in the chat. So last but not least, I want to just share a concept called good food purchasing. This applies to folks who are purchasing food. It's just something to think about. The idea here is when we are purchasing our foods, thinking about what are we supporting with those food dollars. So of course we want to think about nutrition and purchasing healthy foods, but we can also think about, are the foods we're buying supporting the environment? You know, are they sustainable? We can think about, are the folks that are working along the food chain from growth to distribution, are they being paid a living wage? Are we valuing the food service workforce? Are we supporting local economies? So are we purchasing food from folks that are here in Chicago and Cook County or in Illinois or even regionally in the Midwest? And then we can also think of, are we promoting animal welfare with the foods we're buying? So we have partners that work, that spearhead these efforts in Chicago and Cook County. So if anyone's interested in learning more, getting that kind of support, again, let me know and I would be more than happy to connect you. So with that, thank you all so much for your participation and engagement, and I want to go through questions. So I know we have all those questions from the beginning, so I want to look at those. Janie, are you waving at me?
Yeah.
Go ahead.
I wanted to know if you work with other organizations like our population, the homeless, or the ones that have been rapidly housed, or are there other organizations that we could collaborate with?
Yeah, and I mean the other groups on this call do our housing organization, so they are supportive and transitional housing organizations working with those populations. So in all of our group calls, you know, we are collaborating, and if you have specific questions, I'd always be happy to send those out over email. And there's definitely a lot of organizations in Chicago that we partner with, and that, you know, Sydney on the line, my colleague, does more work in the housing space as well. So if there's, you know, specific questions you have or folks you want to connect with, please always feel free to email me with that.
I would really like to know so that we can find out what other people are doing. I I personally don't know.
You don't know who's working in that space?
Yeah, right. I didn't know of our 7 participants where they are working.
Yeah, so as part of this grant, we don't have everyone represented on the phone right now, but as part of this grant, it's you all who received the grant and also Hepzibah, who is on the phone, Heartland Alliance Health, and Hand in Hand Outreach. So they're all supportive or transitional housing providers.
Okay.
All right, so I'm going to go through these questions and see if folks are able to answer them. So I have this first question: is low fat better than fat free? Is sugar free better than low fat or fat free? So Debbie, with the low fat versus fat free, the fat free would generally be the better option. The fat that we're finding in dairy tends to be saturated fat. So reducing that as much as possible, it's not doing that much to help us. And fat-free gives you all the same nutrients, all the same minerals, and are still in there, and the protein's still in there. It's just the fat part that's been taking it out, and it's not those good fats really that are in there. And the sugar-free versus low fat is a really important thing that you brought up, because sometimes they'll take the fat out and put sugar in. There's not a clear, go for sugar-free or go for low fat. They're both kind of things we want to watch out for. So if it's dairy that we're looking at, I would recommend going for a low fat and plain, so like not a flavored milk as much as possible. Does that answer your question?
Yes, thank you.
Okay. And then we have this whole grain versus multigrain. I think we covered that one when we were going over whole grains. Was there anything else related to that, Connie?
No. I do, though, have a question about gluten-free.
Yeah.
Is that any health advantage for anyone who does not have celiac disease? Would anybody else benefit from just having gluten-free? That's on almost everything that you pick up. Stuff is unhealthy, and it'll say gluten, like Twizzlers say gluten.
Oh, Connie, you don't know how much I love that question. That is like my yes, it's everywhere now. The short answer is no. If folks have celiac disease, that's a very serious gluten allergy. We don't know very much about gluten intolerance. It's thought that may actually be a wheat intolerance and not a gluten intolerance. I guess I should back up. Gluten is a protein that's found in wheat. So gluten is, it's actually a series of 3 proteins that's found in wheat, barley, and rye. And it's something that in folks that have celiac disease, it causes their body to attack itself. But because it's just a protein found in wheat, it is not it's not harmful to anyone that does not have celiac disease unless they have some kind of gluten sensitivity or intolerance. But that would be a fabulous example of manufacturers trying to trick us into thinking that Twizzlers are healthy because they don't have gluten in them. Does that answer your question?
Yes.
Okay. So Joseph, thanks for the question about milks for kids. Yes. So kids, we're looking at no milk under the age of 1, whole milk from ages 1 to 2, and after that moving to lower or non-fat milks. Milk alternatives are fine as well. So those would mostly be used if kids have lactose intolerance. So mostly looking at soy milks because they tend to have the calcium and vitamin D in it that kids need, especially kids need for their bone growth. But I'm going to make a note to send you all those specific milk recommendations. Does that answer your question, Joseph?
Yes, it does.
Okay, great. Sue, healthy starches, great question. So starches, a lot of vegetables are actually starches. So if we think about potatoes, including regular potatoes, sweet potatoes, yams, that type of thing, they are starches and they're full of vitamins and minerals, especially if you leave the skin on. So there's nothing wrong with a potato every once in a while. It is high in starch and we don't necessarily want to eat it every day, and it's best not to deep fry it as a French fry or, you know, a tater tot or something like that.
Well, mashed potatoes are a big thing. Those are okay?
Yeah, so mashed potatoes, the concern about it is, you know, everything we're adding into it. So
Butter.
yeah, if it's like butter and salt and yeah, and that type of thing, you know, that's something to watch out for. And also I always recommend leaving the skin on for the mashed potatoes. I know they're not as, you know, consistent that way. You get kind of that mixture, but some people like it that way, including myself. But most of the nutrition is in the skin in a potato. And thinking about, you know, is it possible to add low-fat milk instead of cream, less butter, other seasonings like pepper and that type of thing instead of salt. So there's definitely ways to make mashed potatoes healthier. And you can make sweet potatoes into mashed potatoes as well. And I find that those don't need quite as much of like the cream and salt and butter to make them tasty because they have that sweetness.
So as far as like pastas, we should encourage then the food teams to use the whole wheat pasta and not, okay.
Yep, that's definitely a healthier choice. If you find that folks are having trouble transitioning, I know a lot of people don't like whole wheat pasta right away. It takes some time. You can do like a half and half to start, you know, 1 box of whole wheat, 1 box of regular, and they may have different cooking times. So just look at the box. But that can be a way. And I find that whole wheat pasta works a little better when you have sauces that have a lot of flavor, because then it kind of balances it out. So like if you're doing a tomato sauce, that works really well with whole wheat. But if you're just doing like, I don't know, butter or pesto, it can be a little bit harder. So there's ways to ease folks in. And whole wheat pasta, I do sometimes see it as more expensive, but it's usually like $1 for regular and then like $1.10 or $1.15 for the whole wheat. So it might be a way to kind of ease that in.
Okay. Thank you.
Yeah, of course. Thanks for your question. So Janie, I was seeing a question from you about affordable, low sodium, shelf stable options is what I wrote.
And
go ahead.
And things that have less saturated fat. That and the sodium are immediately what I think about how you could get people to donate, things like that.
Okay. Yeah, I think you're right. And it is really tough with those shelf stable foods. They tend to be pretty high in sodium. If you know where your donors are getting their foods from, I would think about just going and looking for, and that's something you can, you know, tap me for. You get those technical assistance hours, you have 20 hours. So if you want me to go to the store where they buy their foods and look for healthy options, I can make a list for you of shelf stable options that we can, within a certain budget, that we can encourage them to buy.
Yeah, I know we have a wish list on Amazon, and a lot of people just order from there and have it shipped here.
I can look at that, Sue.
Yeah.
I can look at Amazon, and if you give me a budget, try and find some healthier options.
Okay.
Yeah. So then last question I have, Grace, picky eaters. Yeah, it's tough. And again, like thinking about, you know, have we exposed them to the foods, you know, 10 to 12 times, which I know is so much, but just starting with those really small quantities. So if they won't take it, you know, we're not causing a bunch of food waste. But I'd be really interested in getting you guys hooked into Go Knapsack, because there's tons of resources around picky eaters in there and trainings. but it's one thing is to always have, you know, one option that we know the kids like and is good for them. So maybe that's like peanut butter and jelly, having that sandwich always available, but then providing a new food as well to start to increase that exposure. But we definitely want to get them fed, but also kids, when they're hungry, they do tend to eat. So it's, if they know that they can kind of put up a real fuss and get the ice cream or get the snack foods or whatever it is, and not eat what's being provided, then they may be less likely in the future to, you know, to try those foods. But I'll send you all those resources as well. So I think we are at time. Oh, sorry, we're a couple minutes over. So if anyone needs to hop off, of course, do that. But I'm happy to hang on for another couple minutes if there's any other questions.
Thank you.
Yeah, thank you.
Thank you so much for your time.
Thank you all for joining. And I'll send the recording and slides. My colleague who uploads it is out next week, so it'll be the week after, but I'll send that out.
I just have a question. Like, what are some like foods that are like high in energy sources, like for kids? I mean, this website, this like other site you said probably has options, but like I feel like some of our kids, like they just want all those snacky foods. Like, what would be a good thing to provide them that would have like energy for them?
Yeah, that's a great question. So energy comes from calories. So anything that we eat that has calories, our body can convert it into energy. Energy is most easily comes from carbohydrates, and then also from fat. So we think of carbohydrates as kind of like quicker energy and fat as like your slower energy. So if they're looking for like, you know, quicker stuff, then it's thinking about carbohydrates. So those are fruits, vegetables, and grains are all really high in carbohydrates. So if you think about maybe giving them like fresh fruit as a snack, or I know you were talking about granola bars, if we can look for like lower sugar, granola bar options, that type of thing is all going to be like that quicker energy. Or like smoothies, you know, now that we're going into the summer, that all in our bodies turns into energy really, really quickly.
Okay, awesome. Thank you. That's just helpful to know.
Yeah, no problem. Any other questions? All right, well, if there's nothing else, I'm going to close us out. And again, I'll send the recording in about a week or so. And feel free to email anytime, you know, with any questions or to follow up on anything. And thank you all so much for joining.
Thank you.
Bye. Have a good weekend.
Bye.
Bye-bye.
Thank you.